Black History Month is a time to honor the legacy, strength, and resilience of the Black community. And that also means talking about health. Heart disease continues to disproportionately impact Black adults. And this morning, we're joined by Cone Health cardiovascular Dr. Kardie Tobb to talk about what it is and what we can do to protect our hearts. Well, welcome, Dr. Tobb, and thank you so much for joining us.
Oh, thank you, Lauren, for having me. I am so honored to be here and have this conversation with you. It is so important for us to have these preventative and educational conversations with heart disease. And thinking about African Americans, Black people in America is so important because there is significant disparities with heart disease when it comes to being Black in America.
What is driving these disparities? What are the biggest factors?
There are a few things though, but today we'll focus on one or two. One is the advocacy and education. Sometimes people don't know what they don't know. So if you don't know that heart disease is going to be a factor in your life and you're going to be impacted by it, you don't know. The other aspect of this really is the social driver of health. You start thinking about structural racism, how policies are in place. So what I would say is when we start talking about heart disease in people of African American descent and people of color, so think about Hispanics as well as American Indians, we start thinking about where are people located and how can we reach them to be able to educate them and tell them, one, heart disease is the #1 killer. Two, it can be prevented, so what do we do and how do we do it? So there's a few things we'll talk about in this conversation that can be highlighted for people to take 1, 2, 3, 4, 5 steps.
Perfect. And also along with heart disease, stroke, high blood pressure is a big issue as well, and more severe in Black adults. Why is hypertension such a major concern, and how can people start monitoring that earlier?
I always like to describe hypertension as a silent killer. So the person that you don't know is in a closet that's there, right? So one, you will not have any symptoms when you have hypertension. So I'll have people walk in my office and their blood pressure is about 190 and they don't have any signs. So if you don't feel anything, then you feel nothing is wrong, right? So what I'll say to people is knowing the numbers, first of all, understanding your family history to see if you're at risk for heart disease and hypertension. Two, lowering that number, meaning that you're working with a primary provider, getting the numbers for the blood pressure. If you don't have a primary provider, sometimes there are local blood fairs that you can go to, health fairs that you can go to, get that blood pressure checked. The number really, we want it to be around 120/80. That's ideal, but if you're less than 130/80, that's important. A lot of times before people know they're hypertensive or have high blood pressure, they've had heart attacks, they've had strokes, and they're likely on their way to dialysis because those are the destructive things that are happening along the way that people will not feel until the complication exists.
What are some of the common factors that folks might ignore, and what are some other simple changes they can do to better protect their health?
So cardiovascular disease or heart disease as a whole is prevented 80%. So if you do a few things, the only thing that you can change is the family history and some of your race and things like that. But one, eating healthy, picking up food that's grilled, looking more into fruit and vegetables, that's important. If you're the one that's responsible for your groceries, pick healthy choices. That's for starters. So start with the family, right? The second thing that you need to know is, what does regular exercise mean to you? That's not just parking your car right next to the door and walking into your building and thinking that, oh my God, I did a walk today. But be intentional of that 30 minutes a day type walk, really aggressive exercise, get your heart running, getting sweating and things like that. Pick a friend if you can do it, so those are highly important. But one of the things I want our Black folks and our minority folks to understand is you've got to be the barrier in actually empowering yourself for your own health, right? So it starts with a little small faith-based group. So if you're in a little Bible study or you have an organization and things like that, start inviting people that are going to teach you about healthy habits like exercising, things like what foods you're going to pick up. How can you be really having a relationship with a primary care provider, right? In your local area. And sometimes where places like our organization, we have mobile units, where those mobile units are going to be closer to your work, in your neighborhood, and things like that. Because If you know your blood pressure number, less than 130/80, if you know that you don't have diabetes, or if you do have diabetes, you want that hemoglobin A1C to be less than 6.5. And then you want to know your cholesterol numbers. One of the new things that come up for everyone, but more in people of Black descent, is something called lipoprotein A. It's a hereditary factor. I was part of a study called African American Heart Study. It's an observational study. What we saw in that study is, as Black people, we have higher risk for high lipoprotein A. So what that does, it increases your risk for heart disease, it increases your risk for stroke, even peripheral artery disease, meaning clots in the artery. So that's highly important. And sometimes we talk about the implicit bias. Yes, we do have that structural side of it. And if we can clear the social determinants of health, we're able to help people get access. It's highly important for us to make sure that we can help people first start their road to prevention.
I love that when you were talking about getting into the community, spreading that education and awareness. Before we wrap up, what do you really want our viewers to be able to take home with them?
Two things I want people to know: that you're in charge, not me as a physician. I'm here to facilitate. So you're in charge of your health. Well, what I want you to do today is try to understand what your blood pressure is. Get to know it. Go to the CVS or the Walmart. They have a blood pressure cuff. Put that on your arm, sit down, and do your blood pressure less than 130/80. If it's high and you don't have a doctor, please try to make the first effort to get a doctor. Call places. We have lines of phone numbers about where you can get a PCP. The second most important thing is be in charge of your grocery list. Even if you don't have a recipe for healthy eating, these things are free now. You go online and talk about heart healthy diet, less salt diet. You can be able to print that and use that as your grocery list. Don't just walk away from it and just stay with the known, you know. Always have conversations and empower yourself, because once you are in control, you are able to take charge of your heart health.
That was excellent. Thank you so much, Dr. Tobb, for
You're
joining us this
welcome.
morning. You provided so much useful information, and we'll have all these details up on our website.